Cardiovascular. After a cardiac catheterization procedure, the nurse monitors the client for which potential complications. Select all that apply. A. Hematoma. B. Arteriovenous fistula. C. Arrhythmias. D. Retroperitoneal hemorrhage. E. Pseudoaneurysm. F. Myocardial infarction. The correct answers are hematoma, arteriovenous fistula, retroperitoneal hemorrhage, and pseudoaneurysm. Local complications at the site of catheter insertion site are among the most common problems seen after cardiac catheterization, including hematoma, arteriovenous fistula formation, or pseudoaneurysm of the vessel entered, or retroperitoneal hemorrhage inside the cavity if the vessel perforates. A variety of arrhythmias and conduction disturbances can occur during catheterization, but not after the procedure. Myocardial infarction can happen during the procedure, but is rare, with a risk of less than 0.1%. The nurse is performing a physical assessment on a patient with an aortic dissection. Which of the following should the nurse avoid during the physical assessment? Select the correct answer choice. A. Inspection of the abdomen. B. Auscultation of the abdominal aorta. C. Repositioning the patient to the side. D. Deep palpation of the abdomen. The correct answer choice is D. Deep palpation of the abdomen. Deep palpation of the abdomen may cause aortic rupture. The nurse should never perform deep palpation on a patient with an aortic dissection or aneurysm. The nurse should inspect the abdomen for ecchymosis, including turning the patient toward the side to inspect the back for any ecchymosis. The nurse should also auscultate the aorta for bruits. The nurse is providing teaching to a client with newly diagnosed heart failure. Which description or descriptions of heart failure should the nurse include? Select all that apply. A. It is a condition, not a disease. B. The heart cannot handle a normal volume of blood. C. The heart is unable to pump effectively. D. It involves a buildup of fluid in the lungs. E. It results from too much fluid in the heart. F. The heart does not have enough oxygen. The correct answers are A. It is a condition, not a disease. B. The heart cannot handle a normal volume of blood. And C. The heart is unable to pump effectively. Heart failure is a physiologic state in which the heart cannot pump enough blood to meet the metabolic needs of the body. The heart fails because of intrinsic disease or structural defects. It cannot handle a normal volume of blood, or in the absence of disease, it cannot tolerate a sudden expansion in blood volume. Heart failure is characterized by manifestations of volume overload, inadequate tissue perfusion, and poor exercise tolerance. A nurse knows that common cardiac problems or concerns precipitating paroxysmal atrial tachycardia include which of the following? Select all that apply. A. Coronary artery disease. B. Extreme emotions. C. Hypokalemia. D. Hyperkalemia. E. Hypoxia. F. Hypothyroidism. The correct answers are A. Coronary artery disease, B. Extreme emotions, and C. Hypokalemia. Paroxysmal atrial tachycardia is bouts of tachycardia caused by abnormalities in the atrioventricular node and is associated with excess alcohol consumption, stress, or extreme emotions, caffeine ingestion, hyperthyroidism, digitalis toxicity, hypokalemia, coronary artery disease, myocardial infarction, cardiomyopathy, or cor pulmonale, which is right ventricular enlargement due to a pulmonary hypertension. Atrial tachycardias include sinus tachycardia, atrial fibrillation, and atrial flutter. Hyperkalemia and hypoxia are more likely to result in sinus bradycardia. Sinus bradycardia may result from various diseases such as hypothyroidism and obstructive jaundice. The nurse assesses a client with arterial insufficiency, reporting lower leg pain when walking up the stairs, but states that it is relieved by rest. The nurse suspects the client has what condition? Select the correct answer choice. A. Raynaud's phenomenon. B. Vasospasms. C. Lazarus syndrome. D. Intermittent claudication. The correct answer is D. Intermittent claudication. Claudication literally means lameness, and intermittent claudication refers to a cramp-like pain in the leg muscles after a predictable amount of physical activity. It is caused by poor circulation to the extremities because the muscles in the legs, usually the calves, are not getting adequate oxygen to meet increased demands during periods of activity. Raynaud's phenomenon is a vasospastic disorder that compromises blood flow to the extremities and is triggered by cold temperatures or stress, not physical activity. Vasospasm refers to sudden involuntary constriction of blood vessels and is not related to physical activity. Lazarus syndrome is the spontaneous return of circulation after failed attempts at resuscitation. A patient has just returned to the nursing unit after undergoing a cardiac catheterization. Which of the following nursing interventions should the nurse perform first? Select the correct answer choice. A. Administer pain medication. B. Check the insertion site for urticaria, as this could be an early sign of anaphylaxis. C. Administer fluids to flush out the contrast dye. D. Assess insertion site for bleeding or hematoma formation. The correct answer choice is D. Assess insertion site for bleeding or hematoma formation. The insertion site, usually the femoral artery, should be checked frequently for signs of bleeding or hematoma formation. The insertion site is at risk for bleeding due to the high pressure of the femoral artery and the large diameter of the catheter. Fluids should be encouraged to flush out the dye used during the procedure, but the first priority is to assess the insertion site for bleeding. Urticaria and anaphylaxis are not common after cardiac catheterization. Pain medication should be administered as prescribed, but assessing for bleeding takes priority. The nurse is caring for a patient diagnosed with infective endocarditis. The patient has a history of intravenous illicit drug use. Physical exam is likely to reveal which of the following. Select all that apply. A. Osler's nodes. B. Pericardial friction rub. C. Weight gain and agitation. D. Paradoxical pulse. E. Splinter hemorrhages. F. Fever. The correct answers are Osler's nodes, splinter hemorrhages, and fever. Common signs and symptoms of infective endocarditis include fever, malaise, murmur, weight loss, splinter hemorrhages, and Osler's nodes. Splinter hemorrhages run vertically under the fingernails and are thought to be caused by small clots that damage the capillaries in the nail bed. Infective endocarditis most commonly occurs in IV drug users. Other risk factors are rheumatic fever, history of heart valve replacement or dental procedures. Pericardial friction rub is associated with pericarditis. Paradoxical pulse is most likely caused by cardiac tamponade. Nurses can expect which of the following interventions to help regulate or treat patients with atrial flutter. Select all that apply. A. Administration of a non-dihydropyridine calcium channel blocker or a beta blocker as ordered. B. Administration of heparin as ordered. C. Administration of ibutylide intravenously as ordered. D. Sternal massage. E. Cardioversion. F. Preparation of the client for radiofrequency catheter ablation. The correct answers are A. Administration of a calcium channel blocker or beta blocker. B. Administration of heparin. C. Administration of ibutylide intravenously. E. Cardioversion. And F. Preparing the client for radiofrequency catheter ablation. Atrial flutter is an abnormal cardiac rhythm characterized by rapid, regular atrial depolarizations at a characteristic rate of approximately 300 beats per minute and a regular ventricular rate of about 150 beats per minute in patients not taking nodal blockers. It can lead to symptoms of palpitations, shortness of breath, fatigue, or lightheadedness, as well as an increased risk of atrial thrombus formation that may travel elsewhere. This causes cerebral or systemic emboli. Administration of calcium channel blocker or a beta blocker will help reduce the heart rate. Anticoagulation is imperative to prevent systemic embolization initially with heparin in clients with atrial flutter. IV ibutylide, a short-acting antidysrhythmic medication, has a 60 to 90% success rate for converting atrial flutter. Cardioversion promptly restores sinus rhythm in atrial flutter, usually at energy levels as low as 25 to 100 joules. Due to the high rate of recurrence of atrial flutter in patients without a correctable cause, and because of its high success rate, radiofrequency catheter ablation is the definitive treatment. Sternal massage is not a treatment for atrial flutter. A patient with a history of multiple pulmonary emboli is scheduled for an inferior vena cava IVC filter placement. The nurse explains to the patient that the purpose of an IVC filter is to select the correct answer choice. A. Dissolve blood clots. B. Complement anticoagulation therapy by preventing clot formation. C. Prevent clot formation in the lungs. D. Trap blood clots. The correct answer choice is D. Trap blood clots. An IVC filter is a vascular filter that is implanted in the inferior vena cava and used to trap emboli floating in the vena cava. These filters can be temporary or permanent. It helps prevent pulmonary emboli by preventing any circulating clots from traveling to the lungs. An IVC filter does not dissolve clots or prevent clot formation. The nurse is explaining risk factors of heart failure to a client. Which of the following risk factors are considered extrinsic factors? Select all that apply. A. Coronary artery disease. B. Dysrhythmias. C. Congenital defects. D. Diet and weight. E. Pregnancy. F. Hypertension. The correct answers are A. Coronary artery disease. D. Diet and weight. E. Pregnancy. And F. Hypertension. Extrinsic factors are external to the heart and place excessive demands upon the heart, and they can contribute to heart failure. They include coronary artery disease and hypertension, diets high in fat and sugar, and pregnancy. The most common cause of heart failure is coronary artery disease. It reduces blood flow through the coronary arteries and therefore reduces oxygen delivery to the myocardium. High blood pressure forces the heart to work harder to eject blood. The heart eventually fails after prolonged high pressures. Pregnancy increases the body's demands for oxygen and is an extrinsic factor affecting heart failure. The workload on the heart increases in an effort to move blood. Diets with a high glycemic index or glycemic load may contribute to the risk of congestive heart failure, along with a high intake of red meat and high-fat dairy products and obesity. Congenital defects, such as left-to-right shunts, increase preload, the initial stretching of the cardiac muscle fiber length before contraction. This is one of the intrinsic factors arising from intrinsic disease or pathology that can lead to heart failure. Dysrhythmias are one of the intrinsic causes of heart failure because they arise from within the heart. Other intrinsic factors are valve disease and cardiomyopathy. The nurse is caring for a patient that suffered from a myocardial infarction. While monitoring the patient's electrocardiogram, the nurse may make what observations? Select all that apply. A. ST elevation. B. Pathological Q waves. C. Prolonged PR interval. D. A U wave. E. T wave inversion. F. Irregular PR interval. The correct answers are A. ST elevation, B. Pathological Q wave, E. T wave inversion. Myocardial infarctions cause cardiac tissue hypoxia, leading to ST elevation, pathological Q wave, and T wave inversion. Prolonged PR interval is seen with first-degree heart block. U waves represent the repolarization of the Purkinje fibers, or papillary muscles. U waves may be present in healthy patients, but may be a sign of electrolyte imbalances. An irregular PR interval is seen in second-degree heart blocks. The nurse cares for a patient recently diagnosed with Prinzmetal's angina. The nurse explains to the patient that with this type of angina, symptoms may be triggered by which of the following? Select all that apply. A. Cocaine use. B. Eating a hamburger. C. Drinking an iced beverage. D. Being in a stressful situation. E. High oxygen concentration. F. Cold weather. G. Tobacco use. The correct answers are A. Cocaine use. D. Being in a stressful situation. F. Cold weather. And G. Tobacco use. Prinzmetal's angina, also known as variant angina, is characterized by cyclic chest pain that often occurs at rest, typically at night. It is caused by vasospasms, leading to narrowing of the coronary arteries. Vasospasms may be triggered by cold, stress, tobacco use, medications, cocaine use, and magnesium deficiency.